medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
As we discussed in our last video, a compromised microcirculation can become the demise of our patients if we don't attend to it properly. A big part of the issue is that patients will face is that under current allopathic or osteopathic medicine models, there's a serious lack of conventional pharmaceuticals that exist in our toolbox to handle these type of problems. So let's discuss 10 effective and natural considerations with some medications as well that might be helpful for a patient with a microcirculation disorder. Now, it probably, in my opinion, would be best to overlap several of these different considerations to get you the best result. And that's what I do from a clinical perspective. Hey everybody, I'm Dr. Mitch Ghen. So let's get started. First, nitric oxide enhancers would be extremely important in patients of this type of nature. Unfortunately, under the age of 40, or basically after the age of 40, I should say, the use of products that are laden with L-arginine actually may increase the potential for peripheral vascular disease due to loss of specific enzymes. So when you're choosing an item, choose a product that's not based heavily in L-arginine and find those that are based in either like a nitrate or a nitrite, ATE or ITE. Number two, or second, increase the water consumption. There are several great studies that show more than 5 glasses of water a day decreases heart attack and stroke risk by 50%, talking about water, of course. Third, increase the patient's magnesium, especially the chloride salt, because that particular combination is vasodilatory. And if you use intravenous types of modalities in your practice, consider increasing the amount of magnesium chloride in the IV solution for these patients, of course, staying within a very healthy and safe area. Fourth, natural fibrolytic agents such as nattokinase and plasminox help reduce clot formation and thereby improves the tiny capillary circulation. Remember, when it comes to, for example, nattokinase, it has to be given on an empty stomach for it to be absorbed properly. Fifth, become familiar with nutrients and drugs that enhance the parasympathetic nervous system. Many natural items, including certain drugs, can enhance the parasympathetic response. For example, low doses of digoxin or low doses of carvedilol are parasympathetically stimulating. In high doses, they actually do the opposite and become sympathetic stimulating. Sixth, encourage patients to use the general measures that improve parasympathetic response, such as singing and humming and grounding themselves, walking on grass or on the sand if possible, and meditation, of course. Seventh, have your patients drink more beet juice or pomegranate juice, or a lot of garlic freely, or supply your patients with garlic capsules to be taken too. Eighth, use more, enzymes, especially CoQ10, and increase doses to even 600 or more milligrams a day, which is what I do for my patients. Ninth, cayenne pepper is amazing when added freely to patients' food, and it is, of course, an excellent nitric oxide enhancer and an amazing vasodilator. Of course, it can give some irritation to the stomach, but in proper doses or building up, it does a great job. And 10th, last but certainly not least, make sure you test your patients for toxic metals. Their presence does impair the microcirculation, and therefore, your active engagement for the removal by chelation type therapies will certainly not only improve the tiny circulation, embarrassment that these patients have, but improve the long-term outcome of your patients' lives. I hope that helps in understanding a little better, including how to treat the microcirculation. I'm Dr. Mitch Ghen. For more information, go to www.drmitchghen.com. That's DRMITCHGHEN, one word.com. Thank you for joining us today.